Everything you know about chronic low back pain and sciatica is wrong. I'm Dr. Anthony Davis. The big question is it the body? Is there something wrong with your body? Or is it the mind? Is there something wrong with your mind, right? Because one camp of people is saying, oh, you got to fix your body, your alignment, your weak glutes, your leg length, your core stability. Another camp of people is saying, no, it's psychosomatic. You got to do therapy. You got to journal. Maybe it's both. Maybe it's somewhere in between. Maybe it's neither. Maybe it has nothing to do with those things. So let's bring research into the debate and let's settle the debate. I mean, everything in this presentation is a result of analyzing over 1,000 peer-reviewed scientific studies on back pain and sciatica. So after we do that, I'm going to let you decide. All right. I want you to understand for yourself what's causing pain. And then if we agree on our conclusions, I can show you exactly what I do to help my clients step by step through the Beyond Back Pain method. And this is the same method that I use to help Joanna. This is her checking in after working with me, feeling really good. The difference is unreal. Usually I'm crippled after a hard day of doing landscaping work, but not anymore, right? Same method that I use for Ben, where he's able to connect with movement that he finds joy in. Or Michael, who was able to recover from a severe disc herniation. Or Kat, who had multiple surgeries, and we were able to really get her back into weightlifting and strength training. Or Jim, who was able to get back to the golf course, and so on. So I'm going to show you the exact Beyond Back Pain method that I use for them, so you know exactly what I do. Now, I want to be clear, I don't want to waste your time. This is not for you if you're dealing with fractures or spinal infections or tumors, or if you have red flags for nerve damage like foot paralysis, partial paralysis of the foot drop, or if you have saddle anesthesia, which would be like you can't feel it when you wipe, or if you have incontinence. These are all major things that you need to go check out with your local doctor, okay? And frankly, the other one, and this is not a red flag, but this is a red flag for whether I think I can actually help you, is if you are unwilling to think outside the box. There's a lot of misinformation around back pain and sciatica. I'm going to show you the evidence, and I need you to think outside the box. So this presentation, I'm talking to people who have chronic low back pain or sciatica. You probably have recurring flare-ups, right? Good days, bad days, good months even, bad months. You might have some minor to moderate disc issues on your MRI, things like herniations, bulging, maybe a little bit of stenosis, degeneration, that type of thing. This is normal. And then you've probably already tried physical therapy and it didn't really help. And you probably are the type of person who feels like, man, I've tried everything. What am I supposed to do? All right. If that's you, then this presentation is for you. I'm going to help you. My goal is to show you what causes pain, and then I'm going to show you exactly what to do about it. But before I dive in, who am I? I'm Dr. Anthony Davis. I'm a doctor of chiropractic medicine. I have my master's in exercise science. I'm a college anatomy and physiology professor. I'm a certified medical exercise specialist. I have over 1,000 hours of yoga teacher training under my belt and 12 different and growing certifications in movement and rehabilitation. My point is, I have a lot of both Eastern and Western influences. I love the science, but I also appreciate the mind-body connection. But more importantly, I've been there. I had chronic pain for a decade, and it was debilitating. The only way I could numb the pain was to drink myself into a stupor. And this is a real picture of me passed out drunk at the bottom of a staircase, because this was the only way that I could numb the pain. But I figured out how to escape this. I became a doctor. And the way that I escaped that was by really understanding the root cause of chronic pain. And I'm going to wait to tell you what that is, because I want to let you decide after I share 4 undeniable facts about chronic pain. I'm going to let you decide what the root cause is. But once I got clear on the root cause, then I've been able to help hundreds of people just like you reclaim the active life they love. So what causes pain? Let's start there. Before I can tell you how to fix it, if I tell you how to fix it, it won't make sense unless you understand what's causing the pain. So let's be really clear. Let's start off with undeniable, irrefutable fact number 1. There's no debate about this. You cannot experience pain if you don't have a brain. Okay, it seems pretty simple. Now, this does not mean that pain necessarily is in the brain or in your head. It just means that it's impossible to have pain if you don't have a brain. Let's think about it. A disc, like the disc herniation, disc bulge, a disc does not have consciousness, right? The cells inside the disc themselves are not conscious. Same with muscles. Muscles in and of themselves do not have a consciousness. Only a living, breathing, whole human being has consciousness and is aware. Because of that, a disc itself does not actually have pain, right? And same with muscles. A muscle technically does not have pain. Now, a disc in a muscle could have damage, and a disc in a muscle could tell the brain about danger or damage, but only a living, breathing, conscious human being can actually experience pain. Undeniable fact number 2. Nociception is different from pain. Now, nociception is the word for the nerve receptors that detect damage or danger. So let's say you step on a nail, and what's going to happen is a nociceptor in your foot, a nerve receptor, is going to sense that damage. And if there's enough damage, then it's going to metaphorically open the gate and travel along metaphorically a road, meaning it's going to trigger an electrical signal to go up that nerve and into the spinal cord. Once it gets there, it's going to synapse with a new nerve cell, and if it crosses that metaphorical gate, meaning the synapse, then it will travel along the next neuron to the brain, or road to the brain. In the brain, we have another gate and another road. Actually, there's a lot more gates and a lot more roads, but I'm trying to make this simple. And once we get to the brain, we have this neuromatrix of pain. All of these brain regions will light up and interpret the signals that are coming to the brain, as well as weighing it against all of the other information that the brain is receiving at the same time. That could be sight, sound, smell, hearing, but it could also be memory, context, beliefs, and expectation. And the brain will weigh this information and output pain. Pain is not an input, pain is an output. So the brain synthesizes all of the information that it's given at any given time and will determine, is what we're dealing with right now a threat or not? And if it determines there is a threat, then yes, you will have pain. And if there is no threat, if it does not think there is a threat, then there will be no pain. Now, this is how we can have situations where there is damage without pain. For example, a kid, when you were a kid, you might be running around playing with your friends, you fall and scrape your knee, but you don't even notice. You keep running around and playing soccer or playing hide and seek or something like that, or tag, and your friend points out, hey, your leg is bleeding, and you are not feeling any pain until you look at your knee. And as soon as you see the blood, the visual input to your brain says, whoa, danger, alarm, this is a threat. And then suddenly you start to experience pain. So we can have damage without pain, or we could have pain without damage. Phantom limb syndrome is a classic scenario where a person is missing their leg or arm entirely, and yet they have chronic pain where they feel their toes or feel their foot is in pain, or it's that their foot is burning, but they don't even have a foot. So there is no foot to have damage. There is no damage, and yet they have pain in a foot that doesn't even exist. This systematic review looked at over 3,000 pain-free people, and they found that in 3,000 pain-free people at the age of 50 years old, 80% will have disc degeneration, 60% have a disc bulge, 36% have a disc protrusion, and 23% have an annular fissure. They found other things as well. Basically, people who have zero pain commonly have bad-looking MRIs. This study showed that disc herniations rarely cause pain. In fact, disc herniations only cause pain between 1 and 3% of the time. Now, I want to be clear because sometimes they do cause symptoms, and sometimes those symptoms matter quite a bit. So if you have these symptoms, right, if you have a tight band of pain that shoots probably all the way down into the foot, a narrow band, like a shooting band of electricity, that actually could be disc compression of a nerve. Okay, that is legit. You might also have, as your doctor might measure it, loss of strength in your foot, loss of reflexes, loss of sensation. And again, here's the research to support this. But if you have a true disc herniation, truly compressing on a nerve, and it's truly the main reason that you have your symptoms in the first place, these are the typical symptoms that will occur. So this, and here's again research backing this, this is not disc pain. Okay, so if you have, oh, I've got some pain in my hip and it radiates a little into my thigh, usually it doesn't go past the knee, but sometimes I got this weird patch in my shin or something like that. probably not true nerve compression. Or if you have diffuse pain across the lower back and maybe there's a little spot in the hip, or if you have sharp stabbing pain right there in the low back, even if you have pain directly over where the disc is, that is not disc pain, because disc pain usually is disc compression on a nerve shooting down the leg. This is discogenic pain. This is a radiculopathy. It's our stupid word for radiating pain from nerve compression. But this stuff is not truly from a disc. This is why we know, again, research showing that 90 to 95% of low back pain does not have an identifiable structural cause. That means that 90 to 95% of the time, we cannot blame the stuff on your MRI. At least we can't blame it 100%. It might be part of the reason you have pain, but not 100%, right? 90 to 95% of the time, we can't pinpoint a structure that is responsible for your pain. Now, undeniable fact number 3. Chronic pain always involves nociplastic changes. So nociplastic, I'll explain in a second. There are only 3 causes of pain. Here's the research on this one. We have nociceptive pain, which is damage or inflammation. This is what most people think of when they think of pain. The second type is neuropathic, which is true nerve compression. Some people think they have nerve compression, but they don't. Even if it looks a little compressed on the MRI, if you don't have the symptoms that I've already described, you probably don't have really true severe nerve compression. And the last type is nociplastic. Think of neuroplasticity, the ability of your nerve cells to rearrange and adapt over time. Well, they are processing information improperly. So all chronic pain will have nociplastic changes. That does not mean that your pain is 100% nociplastic. It just means that the longer the time is from the initial injury or onset of pain, the more likely it is that you have nociplastic changes. You might still have some nociception. You might still have some pain that is a result of tissue damage or tissue irritation. Hell, you might even have some neuropathic changes as well. But the longer the time, the more nociplastic changes happen. I'm going to explain exactly what those changes are, because these are physical changes in the way that the nerves interact. So nociplastic does not mean not real pain. It just means pain that is not caused by damage, but rather pain that is caused by hypersensitivity of the nerves, not damage. So I want you to picture a brain in the center of a city, as though the brain were a fortress in the center of a city, and you have multiple walls around the city to keep people out. We want to control what gets in and what goes out. And to control that, around these walls, we have these gates in order to prevent things from getting in or out that we don't want to get in or out. Now, if we wanted to deliver a message, for example, a message that there is some damage in the body, if we wanted to deliver that to the brain, we would have to go along a road and cross through multiple gates. But along the way, there do be dragons. In other words, a lot of things can go wrong in the gates and the messenger and the road in order to disrupt the signal. So the signal or message that we're delivering to the brain is not an accurate message. So remember, normal pain processing in the example of stepping on a nail is opening a metaphorical gate, which triggers the neuron to send an electrical signal to the spinal cord. Once that happens, we have to cross a synapse, in other words, open a gate, and then go up to the brain where we open another gate and travel along another road or neuron. Here's the problem. In chronic pain, the gates are just wide open all the time. Now, normally to get through a metaphorical gate, you have to cross security, meaning those gates are very selective as to who they let across. You get stopped and frisked, and it's really hard to get through the gate. But in chronic pain, the gates are wide open. There is no security. Everybody gets through. I'm exaggerating a little bit, but the point is that the gates are open and we're getting a lot of messengers through the gates that should never have gotten through in the first place because it is so easy to get through the gates. Now, literally what I mean in terms of the science is that the messengers are actually inflammatory neurotransmitters like substance P, CGRP, and glutamate, among others. Now, what these chemicals do is they raise the voltage of your nerves. So In order to send a signal along a nerve, we need to increase the voltage of a neuron and then it will send a signal. Now, at rest, your nerves are low voltage. But when they are damaged, sodium rushes into the cell as well as calcium, blah, blah, blah. There's some other things going on, but I'm making it simple. Sodium rushes into the cell. This increases the voltage because sodium is positively charged. And if it crosses a certain threshold, then it's going to send a electrical signal, an action potential, a danger signal along the neuron. So when I say gate, when we have to open a gate metaphorically, this is what I'm talking about. But in chronic pain, even at rest, when there is no damage, your nerves are resting with a high voltage because of the inflammatory neurotransmitters that I already mentioned, which means it only takes a little bit of sodium to accidentally trigger the nerve to send off a danger signal, which means that the signal that it sends is a false alarm. The other thing that happens is called neurogenic inflammation, which is where a nerve cell has a signal that comes along the nerve and it says, oh, I sense damage. Okay, let's send that signal up to the brain. Let's let it know that there's some danger. Then a signal called a retrograde or antidromal action potential goes back down the nerve to the end of the nerve and resensitizes it. So this can happen for a variety of reasons. Thoughts can cause this, but also stress can cause this. And stress is not a thought. Stress is hormones like cortisol and adrenaline from your adrenal glands that interact with these nerve endings in the spinal cord and cause hypersensitization and reverse action potentials. Now, here's what it looks like if we zoom in. Here's the end of a damage sensing neuron. Okay, these are the receptors. Okay, and what happens? Oh, there's a little bit of damage. All right, well, we send a signal up to the brain like we should, but then we get a signal coming back like an echo, and it goes back down to the rest of the branches of that nerve that did not actually detect a damaged signal. And then the ends of those nerves squirt out more substance P and CGRP, which is inflammatory. And that inflammation resensitizes the nerves. And they say, oh my God, there's even more damage. No, 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 no. There was not more damage. There's inflammation. And that inflammation sends off another signal that says, oh my God, there's more damage. False alarm, because it was really caused by more inflammation, not more damage. And then that sends another signal backwards. And then it's just this echo chamber of false signals and then hypersensitization and inflammation of the end of the nerve. And then we just get this inflammatory soup where the nerves are way too sensitive. And interestingly, the brain can actually trigger this to happen based on thoughts and fear and expectations and stress as well. Now, undeniable fact number 4. Stress is not in your head. So even if stress was a large part of the reason that you have pain, it is not in your head. We have a stress pain cycle that cycles between the actual tissues in your low back and the brain, and then your adrenal glands, as well as many other glands in the body, and then back to your back, and it goes around and around we go. So stress, anxiety, and depression and pain, these things are not in your head. For example, stress is a whole body reaction. If we have adrenaline and cortisol circulating in high amounts all the time in your body, we're going to raise your blood pressure and heart rate. We're going to tense and contract skeletal muscle, raise your blood sugar, tell your liver how to metabolize sugar and fat. We're going to store more fat. We're going to have fertility issues. We're going to have joint and bone issues. We're going to have atherosclerosis and heart and cardiovascular problems, memory and focus problems, hypersensitization of the nerves like we just talked about, increased rates of cancer, immune dysfunction, digestive dysfunction. So stress is a physical reaction that occurs in your entire body and every system of your body. It is not in your head. And stress in your back also has tangible changes. It's going to make your muscles tight and guarded and deoxygenated and atrophied or weak and painful. Adrenaline and cortisol circulating in your bloodstream in high amounts for a long time are going to make your joints and discs and nerves degenerate more, have hyperexcitability or hypersensitivity, which is what we already talked about in undeniable fact number 3. We're going to have more inflammation, demyelination. Your nerves are not going to work as well, and bone loss and pain, all these things as a result of chronically high amounts of stress. So much so that we see that people with high stress are 2 to 4 times more likely to drop dead for any particular reason in a given year. It increases all-cause mortality by 2 to 4 times. So if stress can literally kill people, don't you think that it can cause back pain, right? It's not in your head. Here's the neurochemistry of it. Your amygdala is your fear center in the brain. Your amygdala and your hypothalamus will both create a substance that tells your pituitary gland to create another chemical messenger, a hormone that tells your adrenal glands to produce stress hormones like cortisol and adrenaline. And those stress hormones then will trigger the amygdala and hypothalamus to make more of the chemicals that create more stress hormones. So it's a cycle around and around and around from the brain to the adrenal glands and back and forth. On top of that, this is going to affect your mental health. Here's the study showing that high stress levels are going to increase anxious depression, and then the anxious depression is going to feed the stress levels, which feeds the pain, which feeds the stress, which feeds the anxious depression, and around we go. This study showed that people with high stress are 2.8 times at an increased risk of developing chronic low back pain. This study showed that with depression, people who had pre-existing depression and no back pain were more likely to develop future back pain, 2.5 times the risk of developing new episodes. And for the record, the depression preceded the back pain, meaning the back pain did not cause the depression. It was probably the other way around. How does this happen? Well, nociceptors are damage receptors inside of a special area in the spine that we won't talk about, but we have what we're just going to call fight or flight neurons, our stress neurons. Okay, and again, here's the research on this. And these stress neurons literally sprout into the pain centers of the nerves. And so stress signals literally trigger pain signals, if you will. So your nerves can become literally hardwired that stress causes pain. And on top of that, cortisol, stress hormone, high levels of cortisol for a really long time lead to more inflammation. Now, normally cortisol is anti-inflammatory, but what happens is the longer you deal with high levels of stress, we develop cortisol resistance, which is kind of like insulin resistance in people who are diabetic. And what we see is that if cortisol is like a firefighter trying to put out a fire, the longer we have our firefighter at work, the more tired they get. So we have to send out more cortisol, more firefighters, but all of them are getting very, very tired because we're working all the time. And as a result of that, the fire grows bigger and bigger, the pain grows bigger and bigger. So as a result, our cortisol is less effective. Our cells are less sensitive to cortisol. And so we are less effective at actually controlling inflammation. So it's not necessarily cortisol causes inflammation. High levels of cortisol lead to poor control of inflammation, and then inflammation runs rampant. Now, this was especially true for Amy, one of my patients who was majorly triggered her pain by stress and previous trauma and some other things that were going on. We had to teach her, this picture is a cold shower, because one of the homework assignments I had for her in the first week of working with her was to give her a cold shower to teach her how to control her fight or flight response. And within a week after just doing this simple exercise, she wasn't like cured, but she was able to go out and party and go to karaoke and like go to goat yoga and like have some really amazing experiences. My point is that fight or flight control is super important for a lot of people. Let's review. 4 undeniable facts. Number 1, pain cannot happen if you don't have a brain. Number 2, nociception is not the same thing as pain. Nociceptors carry the damage signal or the danger signal, but pain is decided by the brain based on context and threat level. Number 3, chronic pain always involves nociplastic changes, which is where we accidentally fire nociceptors that should not have been fired because there was no actual damage. There was just chemical inflammation due to all the reasons we previously discussed. Number 4, stress is not in your head. It is a neurochemical and neuroimmune change in the entire body. So let's settle the debate here. Is it the body or is it the brain? What do you think, right? And you can, if you're watching on YouTube, by the way, you can put it in the comments. Let me know. What do you think? Which of these things is causing pain? Hopefully, we understand that the root cause now is not, oh, it's not just the body, it's not just the brain, it's the combination of factors. Like the nerve changes, well, they're in the body, but they're kind of connected to the brain. It's both, right? It's both and extra stuff that you probably didn't even think about. So there is no singular cause of chronic pain. Pain is multifactorial. My favorite analogy for this is if you have a cup and the cup fills up with stuff, you can only fill it up so high. And if you fill it up with too much stuff, it overflows, and then you're going to have pain or sickness or burnout or something's got to give. So the cup can fill up with anything. It could be physical stressors, mental and emotional stressors, social stressors, nutritional stressors, poor sleep, whatever. All that stuff is just stuff in the cup. And if the cup overflows, you get pain. So we need to think multifactorial, not itty bitty tiny little things in the spine, because that's not how pain works. So before I tell you what do we do about it, let's just make sure, are you with me so far? Is this clicking? Is this starting to make some sense? Like, okay, I can see why these people would say, it's the disc or whatever, but these people say it's mental and emotional. Oh, wait. They're connected. You cannot separate the body from the mind. You cannot separate the person from the environment. So what do we do about it? And again, I'm going to show you exactly the methodology that I've used for all my patients and clients. Again, this is Joanna again, going to a 5K, zero pain during and after the race. It's a miracle. 6 months ago, just putting on a fitted sheet was a stretch. Amazing. Or Connor, who had disc herniation and was told that bending would make it worse. Guess what? He got back to karate and golf and playing sports and hiking and all kinds of cool stuff. Or Krista, who had major chronic low back pain, had to give up her yoga practice. Eventually, we got her ditching the hypermobility and picking up weights and strengthening her body and mind, and she got better. Or Lucas, who we got back into soccer. There was a lot of nervousness around soccer and travel, and he went to Japan and didn't have flare-ups. He had a good time there. Ben, who was able to, really connect with movements that he enjoyed. That was a big part of his rehab. My point is, here's the methodology that I've used for all those people, okay? So first things first is we do a 4 pillars approach. We look at exercise, nutrition, mental health, and sleep. And it's going to be a little different for each person. One of these things might matter more or less for each person, but we need 4 good pillars to hold up the roof. So in the Beyond Back Pain methodology, here's what we do. We start off with a 4 pillars analysis to look at exercise, nutrition, sleep, and mental health. And what we do is based on that, we put together a program that's customized for you, right? Because everybody's going to look a little different. Let's start with exercise. With exercise, the first thing we do is a functional movement assessment, put you through a specialized series of movements just to see what is going on and what type or level or intensity of exercise you are capable of doing. And then we put it in an app, tell you exactly what to do, when to do it, hold you accountable to doing progressive exercise that starts you with easy stuff, then medium stuff, then harder and harder things over time so you get stronger. Number 2, I always give something to regulate people's nervous system, because even if you say, oh, I don't have a lot of stress, which most people have stress, even if you didn't, just being in pain for a long period of time is stressful in and of itself. That is putting your body in an alarm state. So we need to regulate the nervous system. Some people don't like the idea of saying, oh, we're looking at mental health because mental health has a stigma. So it doesn't have to be anxiety, depression, whatever. It doesn't have to be something like that. Like, oh, I don't have any trauma. Okay, that's fine, but your nervous system is all out of whack because you're in chronic pain. Your body's in an alarm state. So we need to stop that from happening. Next, with food and sleep, this is all about recovery. You can do all the exercise in the world, but you have to recover and rebuild that tissue to make your muscles stronger long term. So we need to eat healthy food and get good sleep. If you're not doing that, we figure out a way for you to do that. And lastly, and I think this is really the special sauce here. I find the special sauce is that we actually take a 4 pillars holistic approach. But even that, if we don't customize it to you, it's not going to be very helpful. So this is, I think, one of the most important things that separates me and what I do from most people is not that I'm magic, not that I have some clever system, although I do think this is a great system, but really is that we get one-on-one coaching, chat support, weekly check-ins, one-on-one calls. And at the moment of recording this, all of this is directly with me. A lot of times you sign up for a program and you're promised coaching, but you actually just get like Facebook support, or, you're pawned off to an intern or a coach instead of a doctor. Like those types of things are misleading and really frustrating. But when you have one-on-one support and you have the education of what to look out for? What is safe pain? What is unsafe pain? How much should I push? When should I push? How do I know which of these four pillars actually matter for me and which ones I can ignore, right? Once we plug you into the equation and we communicate, you and I together over 12 weeks, if we do that and then use the coaching and feedback to tweak the exercise program, tweak the nutrition, tweak the stress management strategies. Meditation doesn't work for everybody. For some people, just doing art or playing guitar or, hanging out with their kids, that is stress relief. Cool. My point is, this is the magic. It's having somebody with you along a journey to customize a program and look at your whole life. I don't have any magic, special, secret sauce other than really good communication and really caring and being fully invested in your success. That's the magic. So that's what we do in the Beyond Back Pain method is look at it from a 4 pillars approach, put you through a personalized movement assessment, make sure you're regulating your nervous system, take care of your recovery so you can rebuild and become more resilient. And then you and I communicate over 12 weeks. I am personally invested in your success. Use your education to understand the science of pain and what to do about it and when to push, when to pull back. And then as long as we communicate, we're going to make progress. How could you not make progress if that happens? That's what I do. And it works, right? So if that's something that you're interested in exploring, if this sounds like something that could help you, then I'm offering a free breakthrough call. You can book a call with me, get on the phone. Let's talk a little bit about your unique situation and see if I can help. This is not a sales call. Okay. I take a lot of these calls. I turn the majority of people away from my program because they're not a good fit for various reasons. If I cannot help you, I will not take you on as a client. If I do think I can help you, then great. I'll tell you about that. But if I don't think I can help you, I'm going to point you in a different direction. So if free call, we have the opportunity to figure out a little bit about what's going on. Best case, you get accepted into the program and it changes your life. Worst case, you jump on the call, you learn a couple of new things. We have a few insights, but it's not a good fit. And I point you in a different direction. And at least you learn something along the way. So if you're interested in learning more and you want to see if I can help you, then go ahead and book a call. The link is either in the description or there's a giant button or there's a link. There's a link there or a button for you to press. So go ahead and click the button, hit the link. And I can't wait to talk to you and see if I can help.